Hi there, I'm Dr. Nancy DeRubo, a family nurse practitioner. In the next few minutes, I want to tell you which 4 shots for adults are so important for you to update regularly for your patients. Over half the adults in the United States are not current with their immunizations. Healthy adults get exposed and expose others to vaccine-preventable diseases when visiting young grandchildren, flying on an airplane, going on a cruise, and even just going to the grocery store. We're doing a good job immunizing our pediatric populations. But do you check your adult populations thoroughly for their immunization status too? Remember, immunizations for vaccine-preventable diseases decreases morbidity and mortality for your patients and also protects vulnerable populations in your community. By the way, are your immunizations up to date? Here are the 4 most important shots for you to talk to your patients about at their next visit. Number 1, the flu vaccine. The once-a-year flu vaccine is a must for everyone. Up to 85% of seasonal flu-related deaths and 70% of seasonal flu-related hospitalizations occur in people over 65, according to the CDC. Number 2, pneumococcal vaccine. Older adults are more likely to develop complications such as pneumonia, septicemia, and meningitis from pneumococcal bacteria. There are now 2 different vaccines you need to give. The first is PCV13 or Prevnar 13 and Pneumovax 23, PPSV 23. The CDC recommends that all adults 65 and older have both shots a year apart, starting with PCV13 Prevnar first. Be aware that certain high-risk groups need vaccination sooner. If your patient hasn't had both different forms of the pneumonia vaccine, update them now. Ask about all the different places your patient may have received vaccinations and update your records. If they don't know, track them down. Give every adult a written immunization card to keep with them, especially for travel, even if it's just to visit the grandkids in another state. Number 3, shingles vaccines. Shingles is a reactivation of the chickenpox virus from childhood. The vaccine reduces the incidence of zoster and decreases postherpetic neuralgia, a condition often treated with opioids because of its severity. So protecting patients from zoster can also play a role in reducing exposure in communities to opioids. Zostavax, the first vaccine developed, is recommended for all people over 60, but its effectiveness decreases over time. So Shingrix was developed. If your patient had Zostavax, they need to get Shingrix, a series of 2 shots a month apart as well. If they never got Zostavax, then just give them the 2 doses of Shingrix. It will be easier for you to administer Shingrix in your office because it only needs to be refrigerated, unlike Zostavax, which requires it to be kept frozen until use. Number 4, Tdap vaccine. Adults need a Tdap vaccine once as an adult to protect them from tetanus, diphtheria, and pertussis. Many people confuse TD and Tdap. So if someone tells you they got a, quote, tetanus booster elsewhere for an injury, it might have been either a TD or it could have been a Tdap. So you need to get a copy of records to see what your patient actually got. In an ideal world, every state would have a vaccine registry where there would be one central repository of all vaccine records. But until then, we need to track down the information to ensure that our patients are protected. Many hospitals now require anyone visiting newborns to have proof of a Tdap vaccination. If your patient comes in requesting one, use this as an opportunity to check to see if they're updated with their other immunizations too. Keep them all updated all of the time. To protect themselves and those they love. This is a great motivation to help with people who may be vaccine hesitant to increase compliance. Not only are they doing it for themselves, but they're doing it for the other members of their family and community as well. Our goals are all the same: to keep our adults and elders and everyone they come in contact with protected from vaccine-preventable diseases. Immunizing your patients is the single most important thing you can do to reduce pain and suffering and even save a few lives. Every day, at every visit, update everyone's immunizations. Here at Beacon Continuing Education, we're lighting the way to knowledge with CE programs live and online that help you apply everything you need to know to your clinical practices now. So check out some of our other offerings too.